I'm a native New Yorker. I'm not from Chicago originally. But up there, I just have a few pictures. I've been married for 23 years. I have two teenage boys, 18 years old and 16 years old. And I just wanted to share those just to show you all what motivates me every day and what makes me want to get up every day and, live with lung cancer and do my best to advocate for myself and others. My story basically was I was diagnosed with stage 4 non-small cell lung cancer that was EGFR positive in December 2013. Total shock to me. I had some problems with my right elbow. I couldn't straighten it. It hurt. And to make a long story short, over about 6 months of physical therapy and orthopedist visits and rheumatologists and cortisone shots, I found out I had a mass in my elbow. Further scans and biopsies took place, and before I know it, I realized I learned that was a metastasis of the stage 4 lung cancer that had been growing in my lungs. I had no idea I had lung cancer. I didn't have breathing, wheezing, coughing issues, nothing like that. But by the time I was completely diagnosed, I had 8 brain metastases. They were small, but they were there. I had, a main mass in my lungs with several nodules and a pleural effusion, and I had bone involvement, both my elbow, my neck, small areas on my ribs, and in my pelvis. So I had a lot of cancer. Fortunately, I, had mutation testing. I'm in, the Chicago area. Then I was at Northwestern, but now I'm at University of Chicago because my oncologist moved from place to place. But I found out I had an EGFR mutation, and my first line of treatment was a targeted therapy pill, Gilitrif, also known as afatinib, and I had a fantastic response to it. My brain mets disappeared, bone mets healed over, lung, tumor shrank to the point where, even my oncologist was wondering whether it was just scar tissue. And I lasted on the afatinib for close to 3 years, did very well. About that time, I started to develop a little bit of progression in my lungs that my oncologist saw on a scan, and we ended up following that for about 6 months because it wasn't big enough to biopsy initially. I had a liquid biopsy which showed nothing, no EGFR, no T790M, nothing. And fortunately, my oncologist knew that just because the liquid biopsy showed nothing, that didn't mean that there was nothing there. So eventually, we were watching it, and it got big enough to biopsy. I had a tissue biopsy, discovered T790M, and went on osimertinib, Tagrisso. And I've now been on that medication for about 2.5 years. So my entire treatment to date has been targeted therapy since I was diagnosed, around almost 5.5 years ago. So one of the reasons why, I, am so interested in advocacy and research advocacy in particular is because I wouldn't be here at all if it wasn't for research. I mean, both of the targeted therapy medications that I went on just months after they were FDA approved. And, I haven't had radiation, I haven't had surgery, I haven't had any other treatment. So, I mean, if, that isn't fortunate, I don't know what is, and I feel that it's very important to give back and help others in the community. Now I'm going to start talking a little bit about the EGFR resistors, and I, of course, want to acknowledge that ALK, ROS1, they're exon 20. There are other communities out there who are also doing incredibly amazing things in research, but I'm just going to focus on EGFR because, that's my group. So anyway, Before I get into the nitty-gritty about the EGFR resistors, I just wanted to mention that all of these patient, focused, mutation-driven groups pretty much have the same aims, and those are what, we have up on the screen. We want to improve the outcomes for a disease in 4 different ways. Joe already talked about, supporting patients and caregivers and increasing awareness and education with our online communities and improving access to, diagnosis and treatment through our online communities as well. But the 4th item, and that's what I'm going to focus on now, is how we are working to accelerate and fund research. Here you can see a slide that shows our research collaborations to date. And before I kind of go into that, I want to mention why these research collaborations are so important. There's been a lot of talk about EGFR and EGFR mutations at this conference mostly because the EGFR mutation was really the first one that was discovered and the first one that so much research has taken place in. But, lately, now that we have osimertinib and it's in the front line and people are on it, later lines, we really need to figure out more treatments and the next treatments. And in order to do that, who's better, to kind of push that forward than the patients who need the treatments? Of course, along with everyone else, but we kind of, we know what we need and we're very motivated. And we're trying to make EGFR lung cancer into a chronic disease, like something like asthma or diabetes that, you take a medication for, and if eventually that stops working, there's something else, to be there. And we are using the strength of our membership. We formed the EGFR resistors in mid-2017, so just about well, I guess we're coming on almost 2 years. But in that amount of time, we were able to gather, we have very close to 1,200 members who are part of our online community. That's patients and caregivers, but the majority of those patients, probably about 85% are patients. So that's a huge number of people. And we're using the power of that community, of the whole, force within numbers to really try to make a difference and, form partnerships. So our first 3 partnerships that we've formed so far are with CEC Oncology, LUNGevity, and the Bani Dario Lung Cancer Foundation. And I'm going to talk about each of those a little bit in detail. So we connected with CEC Oncology early on in our formation as the EGFR resistors. CEC Oncology is a group that focuses on continuing education for doctors, for nurses, for pharmacists, for other medical practitioners. And the company is owned by this incredible woman named Joni Fowler, who is, if you think Jill and I have a lot of energy, she is like the Energizer Bunny. She really is. We love her. And one of the things that CEC Oncology does, really well is they do EGFR grand rounds in hospitals. So their interest in EGFR and our interest in EGFR was pretty much a natural fit. So last year at ASCO, CEC helped us secure a grant to have our inaugural think tank. And that's a picture from our inaugural think tank. Josh Baumel was there. You can see, I think, the back of his head. It's not the best. It's not the best. Or the side of your head, yeah, so, but he's there, trust me, as were some other prominent oncologists in EGFR, such as Leisha Sequest and David Carbone and Ed Kim, and the focus of the think tank was to really discuss with them, with these EGFR thought leaders, what, we all viewed as unmet needs for EGFR patients, both in the clinics in terms of testing testing and testing interpretation, and in research in terms of new discoveries and treatments. And it was a fantastic meeting, and it really helped us kind of hone our focus as the EGFR resistors for what we wanted to work on. And we continue to collaborate with CEC Oncology. Actually, next week, Jill and I are headed to Anaheim, California, because we're going to be part of a symposium at the Oncology Nursing Summit that's taking place there. And we are going to be live case studies with CEC to talk about, EGFR diagnosis and treatment and side effects. So we're really looking forward to that. Plus, talking to nurses. Nurses are often, the closest contact to patients. So we really think that that will be, a good way for us to spread some awareness of our group. About maybe 3-4 months ago, kind of the end of 2018, we launched a big project with the Bani-Dario Lung Cancer Organization with Dr. Pasi Yane, who is a Dana-Farber and is pretty much the father of the EGFR mutation. He's one of the discoverers of EGFR inhibitors and the mutation. And with Champions Oncology, who is a company that makes cancer-related models. Now, let me explain what a PDX model is, because, if you had asked me a few years ago, I would have had no clue. So PDX, it stands for patient-derived xenograft. And not that that tells you a lot more information, but basically what it means is that they take a small piece of tissue from a patient biopsy and implant that into a mouse where hopefully it engrafts and is grown, and then those mouse models can be used by researchers to test new drugs and, see how they work, because the immune system, the whole biology of the mouse is similar enough to us as humans, where if a drug works in the mouse, there might be a good chance that it would work with us. So it's a very good way for them to be able to test drugs. Now, the reason why we're involved in this space is because we found out that, post-osimertinib, there really aren't, a lot of PDX models for the different resistance mutations, especially for C797S. So what our role in this is that we're trying to make sure that our whole EGFR resistors community knows about this project. So if they progress, we have 3 cohorts. It's actually someone who's progressing on first-line osimertinib, someone who's progressing on later line osimertinib, or someone who has an exon 20 mutation. And if they progress and need to have a biopsy, at the same time as they have that biopsy, they can also have a little bit of extra tissue taken and sent to Champions Oncology, and that tissue would be donated to hopefully, be implanted and engrafted in a mouse model. So really, it's a process that would be seamless to the patient, because we have an 800 number that they can call, and it's all coordinated between Dario and Champions and their hospital and oncologists. But the patient really, somebody who participates in that, really could help the future of research. So it's a very important project that, we're hoping people in our community will consider participating in. And once we have models up and running, we're going to make sure that they're open access, so that, researchers, whether they're in academia or in industry, can benefit from using them for research. Jill and I actually just presented a poster about this at AACR, and there was tons of interest in these models, because while, some institutions may have a few, there's nothing like this right now that exists that, could cover a wide variety of mutations and be open access. Our next collaboration, and this isn't even officially announced yet, so you guys are getting a preview. It's actually going to open in the next few days, and we're going to have a press release out later this week, is the project that we're doing with LUNGevity that's called Project Priority. And Priority stands for Patient Reported Initiative on Resistance, Incidence, and Treatment Study. So basically, we are trying to do a comprehensive and thorough study about the experiences of cancer patients and caregivers, and what goes on when you're diagnosed and treated and progressed. And we had previously had in our online Facebook group when it first started a small, questionnaire. Okay, it was 10 questions or so that the founders of the group made up. But this study is going to be IRB approved, which means there's an institutional review board that has to approve our entire study design and all of our questions. And the point of that is to make sure that patients are protected, confidentiality of data and things along those lines. But it also means that we can take this data that we're going to gather from the study and we can publish it, we can share it with researchers, and we can really use it to drive treatments, because how powerful could it be other than to say we, surveyed, I don't know how many we're going to do, but say we get 500 responses. Wouldn't that be awesome? And we found that, people are concerned about this, people need that. We feel like it's going to, hopefully be very, very powerful. And I really encourage, anyone in this room who's an EGFR patient or caregiver to complete the survey, look out for it, send it to your friends, tell anyone you know, stop people on the street, whatever it takes. So that's the brief summary of the 3 projects we have going on right now, and we are looking forward to further collaborations. We're open to collaborating really with anyone who has an interesting project, whether it's an advocacy group, a researcher, industry, etc. And as you can see up there, we really believe oncology is a team sport and needs these collaborations. And as patients, not only are we reaching out to find these collaborations, but we're, now that, we've been going to conferences and talking about our group, and other, oncology and other medical players have mentioned our group greatly, we find that we're being contacted by some of these partners as well, and they're interested in working with us. And we feel that's the way it should be, because it really is a team effort, and we can just accomplish so much more if we all work together. So,
can I say one thing?
Of course you
The
can.
only thing about this slide that should be different is patients should be in the center. Okay, so everything that we do, patients are in the center where everything is organized around them. They're not put in the middle where they have to navigate. So
you can redo the slide for the next presentation. I just nominated you.
Well, it's my fault too. But just seeing it this way as opposed to working at it, I'm like,
no, it's a good point.
Oh,
well, and thank you very much, everyone, for the opportunity to present about our group.